Friends, welcome to my channel. In this module we will discuss about stridor. So basically we will deal with definition and pathophysiology parts of stridor. Okay, so basically what do you mean by stridor? It is nothing but the noisy respiration which is produced due to turbulent airflow through narrowed air passages. Okay, the respiratory passage is shown in this diagram. Can you see here? The nostrils and the mouth which go backwards, and the nostrils is connected to the nasopharynx behind, and oral cavity is connected with the oropharynx behind. Okay, so basically this nasopharynx and oropharynx are parts of pharynx. Yeah, as you know, pharynx consists of nasopharynx, oropharynx and laryngopharynx. So then the pharynx communicates with the larynx here. This is the larynx, and then the air flows through the trachea. Then the trachea divides into two bronchi, the right bronchus and the left bronchus, and from the bronchi the bronchioles originate. Bronchioles. Okay, so basically bronchioles originate from the bronchi. These are actually the bronchioles, and finally the bronchioles reaches the alveoli. Okay, so this is the respiratory passage, alveoli in the present in the lungs. So this is the basic respiratory passage which is present in the human. And so if any obstruction, suppose this is the normal lumen. Okay, this is the normal lumen. If any obstruction occurs in the lumen, then what happens? The lumen becomes narrowed lumen. Okay, so in this lumen, if air flows through it, it results in turbulency. So that turbulency causes the production of noise or sound, which is called as stridor. Okay, so the definition is noisy respiration. In one term, if you want to say, it is just the noisy respiration that is produced by turbulent airflow which is passing through narrowed air passages. Okay, as you know, I had said you before, I had shown you the picture. The air passage that starts from the mouth and nose, that is nostrils, and then it reaches the nasopharynx, oropharynx, laryngopharynx. These three are actually the parts of pharynx. Okay, pharynx, and then the air flows through larynx, trachea, bronchi, and finally alveoli. Right? So any obstruction due to tumor or due to infection, if occurs at this area, that leads to lumen narrowing, which causes the production of a sound called as stridor. Okay, so this is the basic pathophysiology which occurs behind the stridor. So with this, let us conclude this module. In the next module, we will discuss about the etiology, causes, as well as clinical features of stridor. Okay, thank you so much.